Session. All others, don't write anything. Don't write anything on in the chat box. Just listen silently. Session. Yeah. So my video is on. If you want to open your video, your wish. If you don't want to open, just keep it like that. Right. Yeah. Yes. Okay. If you want, you can take the video. Otherwise, you can leave it. This is the question paper. Right. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are conducting a speaking session and this is a nursing specific role play card. And we have with us Pooja Kesari from Nepal. Yes, Pooja, once you are ready, you can start.
Yes, I'm ready, sir.
Yes.
Okay. So, sir, have you set the timer for 5 minutes?
Yeah, you can start.
Okay. Hello, good afternoon. My name is Pooja Kesari and I'm one of the registered nurses working in this community health center. How may I address you?
Yeah, actually, my name is Nancy Lincoln. And Mrs. Nancy Lincoln, you can call me Mrs. Lincoln or you can call me Nancy. I am 35 years old.
Okay. So, Nancy, nice to meet you. So, Nancy, from your case note, I can see that you have been referred here by your doctor for receiving further advice about dietary adjustment. Am I right?
Yes, of course, nurse, you're absolutely right.
Okay, thank you for my confirmation. So, before proceeding further, Nancy, could you please tell me, do you have any further question regarding your condition?
Yeah, actually, I
Mm-hmm.
am a vegetarian and I do not
Mm-hmm.
cook because of my hectic lifestyle and I mainly depend on ready meals for convenience.
Okay, so Nancy, if I understand you correctly, you depend upon vegetarian diet, and most importantly, you did not cook by yourself. Am I right?
You're absolutely right.
Okay, so Nancy, let me explain to you that the iron is only one of the source which we can get from our diet, but it can be low in vegetarian without planning. But let me reassure you that we can treat with dietary modification. So, are you getting my point?
Yeah, of course, nurse. The
Okay,
doctor has explained
so
me that I have anemia. I have, yeah, I've been asked to speak to you regarding some dietary suggestions. What exactly is my problem, nurse? Is it very serious?
I do really appreciate your concern, Nancy. So, yes, you are absolutely right. The doctor is mentioned that you have been diagnosed with a condition that is called anemia. So, let me explain to you more about anemia. Basically, it is a condition when the amount of blood in our body is low. And in your case, the total amount of blood is it like 8 gram per dl, which indicate that it is slightly lower than that of its normal range. So is it clear so far?
Yeah, of course, nurse. That's absolutely clear. But yeah, I am a little bit confused by the diagnosis. how it relates to my diet. I choose vegetarian ready meals because I believe they are healthy. And you say some problem with me. I don't understand.
Mm-hmm. Yes, if I were you, I will also feel the way you are feeling right now. But let me clarify your concern regarding your diet. So, Nancy, at first, in vegetarian diet, if we will go unplanned, then it usually contain low amount of iron. So that is the reason in your case. So I hope it's clear for you now.
Yeah, of course, nurse. What you're saying is I'm clear regarding that one. And let me
Mhm.
tell you one thing regarding my dietary routine. I have
Yes, of
coffee for
course.
breakfast, frozen
Mm-hmm.
meats for lunch, coffee and cake for afternoon
Mm-hmm.
tea, and I rarely
Mm-hmm.
eat a dinner.
Okay. So let me clarify what I have got the exact information from you that you drink coffee and also you take beans in your diet. Yes.
Okay.
Okay, so Nancy, now I'm going to provide you some information which will help to increase the dietary regarding iron intake in your diet. So, shall I?
Yes, of course, nurse.
Okay, so Nancy, it is really important to add some beans, green leafy vegetable such as spinach, iron fortified cells, which is really a good source of iron. But please remember, it is really important to reduce the consumption of coffee, as you have mentioned earlier. So, are you willing to do that?
Yeah, of course, nurse. Definitely, I'll do that one. But I'm not very keen on that one because I dislike a tofu and I dislike a
Mm-hmm.
green leafy vegetables.
Mm-hmm.
Coffee helps me cope with the stress of my work. So, what is the problem with this?
That is really a good question from you, Nancy. Yes, I understand. At first, it might be really difficult to change in your diet, but I reassure you that if you follow this guideline, which I have provided regarding your diet, then definitely you will see some changes in your diet after 1 to 2 days. Okay.
Okay, nurse.
And Nancy, let me inform you that it is really important to combine your food as compromise. So you can take your diet like between 1 hour consuming iron rich food and coffee to increase absorption of vitamin C at the same time. Are you getting my point?
Yeah, of course, sir. Okay, I'll definitely follow your suggestions, nurse. I agree to the recommendations, but I'm not interested to reduce my coffee consumption. I will not reduce at any cost.
Mm-hmm. Okay, I do really appreciate I do really appreciate your interest and your desire towards coffee. But do you know that if you will continue taking coffee, then it might be really a danger for your health. So I strongly advise you please follow this suggestion. It is really helpful to prevent from further complication in upcoming future. So, is it clear for you now?
Yeah, of course, nurse.
Okay, so Nancy, are you willing to follow this dietary advice?
Yeah, I'll follow them, nurse. Definitely, I'll follow them. Thank you very much for your valuable time. Is there anything else that I need to know, nurse?
Right now, I have cleared you, I have explained to you everything, but no worries, I will provide you a leaflet after this conversation which contain all the information regarding your diet. So please go through that, okay?
Okay, nurse.
Okay, thank you. Thank you for coming here. And if you have any queries, you can contact me at any time.
Yes, nurse. Okay, right. Now let me give you some feedback for your speaking. And here it is. Yeah. Okay. Yeah, let me give you some feedback regarding this. I'm sorry, my shutter was closed. That's why. Yeah, now let me see. Pooja Kesari. Right. Don't speak anything until I ask you to speak. What you have to do is, I did not ask you. That is your wish. So now what you can do is, yeah, I'm giving you some suggestions. Don't speak anything. Afterwards, I'll give you time. Then that time you can ask your doubts and other things. Let me explain to you. There is no need to say, let me explain to you. Let me explain you. That is enough. To is not necessary. To is not necessary. Let me explain you. I will explain you. Let me explain you. I can explain you. To is not necessary here. The next one, second point is like that one. You're making some sounds. These are called unnecessary sounds. These are called unnecessary sounds. Unnecessary sounds. So avoid these unnecessary sounds. Avoid these unnecessary sounds. Don't use these sounds in your speaking because it looks vague, you know, it looks, it troubles the person to understand you. Next one, number 3, 8 gram. 8 gram. No, it's wrong. 8 grams is the right option. 8 grams. You have to say not 8 grams, 8 grams, singular and plural. You have to bother about that one. Singular and plural is very, very important. When it is singular, you can say 8 gram. And if it is plural, you can say 8 grams. So remember that one very clearly. Don't make a mistake like this again. Okay. Next one. Nancy, 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 Nancy. How many times will you say Nancy? It is not right to repeat so many times. Okay, it's not very good. I don't know why you're telling so many times Nancy. No need. Okay, just for confirmation purpose, you have to speak. Okay, next one. Pauses and breaks. Many times you're stopping in between. That is not recommended. You're not supposed to make pauses and breaks every now and then. So it should not be more than 2 seconds, maximum 3 seconds. That's all. Next one. Green leafy vegetable. You said green leafy vegetable. Green leafy vegetables, plural. Green leafy vegetables, you have to say, not singular. The next one. These suggestion. These suggestion. These, plural. Then you have to say suggestions. These suggestions. And regarding the pronunciation also, suggestion. Son, you are saying suggestion. Okay. Information. Information. Suggestion. It's not son, it is a shan. 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 Sha. 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 Like she. Sha. Suggestion. Information. So you have to follow that one. Next one. Yeah. Next one is further complication. Further complications. Here also you're saying son. Complication. Complication like that. So who's this? Yeah. Further complication. Complications, plural. Complications. Always try to use plurals. That is better. Then information. Information only. It's not informations. It is information only. You cannot say informations. Information is uncountable. Okay. Information is uncountable. Right. Something problem with my video. Okay. So information. Here also you are saying son. Information. 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 Maybe a pronunciation pattern. Many people are speaking like that and you are speaking like that. It is not son. It is a shan. Sha. Sha. Shan. Remember that. It is shan. Okay. The next one. So these are some points. Now coming to the point, your grammar. Okay, there are some mistakes. That's what I told you, grammar mistakes. Then there are some vocabulary problems also. You are using ordinary vocabulary. You can use high-level vocabulary, better vocabulary. Don't use ordinary vocabulary, better vocabulary. Try to use C1, C2 vocabulary. The next one, pronunciation. Pronunciation, I have told you, 2 or 3 places where you are pronouncing wrongly. You're saying son, son. information like that you have to rectify. So you have to say sha, shan. Okay. Next one, fluency. Yeah, you are fluent, but you are going very fast. You're going very fast sometimes, and you're getting stuck. Go at a normal pace. Don't go very fast. Don't go very fast. Go at a normal pace. That is what I'm saying. Then accuracy. Accuracy, you have to bother regarding accuracy with the grammar, accuracy with the vocabulary, accuracy with pronunciation. All the three types, okay, of accuracy you have to follow them. Now, so now, yeah, yes, now you can speak what you want. If you have any doubts, you can ask me. Unmute, please. Unmute, please. Pooja. Yeah, Pooja, unmute.
Hello, sir. Yes.
Yeah, you got the points.
Yes, sir. Like how to pronounce that son? Complication?
SH, complication. Sha.
Complication.
Repeat after me. Sha.
Sha.
Complication. Sha. Like she. You say she, no? Tell she.
Complication?
That's right. You got it. Practice 10 to 20 times, okay? So that you'll get strong. Is that clear? Okay. So that's fine.
Yes.
This is